I was in the hospital for 8 weeks prior to their delivery, so hospital days kind of run together for me. But when I can sit down and look at the beads and lay them out on the table, you can really see how much we've gone through, how many days have passed, and the progress that was made.
The Beads of Courage program is something we're just going to implement in our NICU, and it's an evidence-based program. There's a lot of research behind it. What they found is that families need to be able to tell their story, and this is one way they can do that. So when a baby is born, comes into our NICU, we start them off with a necklace, and they're given beads based on what occurs during their NICU journey.
The beads themselves have changed, and so you can see it in the colors. Towards our stay now, 21 days in, there are fewer beads in between days. And then the beads that are in between days are more representative of like a parental first. So, when I either hear myself gotta hold one of the girls or feed one of the girls, or, it's not an intubation tube, or it's not, an IV line. It's something that's memorable all the same, but a little bit nicer.
So they can garner beads, not just on firsts and special occasions, but also through very difficult times. So perhaps a family is able to look at that bead and say, we made it through this. All the beads are specifically given for different situations, and so the parents with their journal can relate their story, their time in the NICU, to their family and friends. And the families themselves find it very healing.
Almost everything else about the twins is exactly the same, but there are a couple of differences in their chains that'll be nice for them. I didn't get to hold either of them until after she did. I didn't hold Serafina until 3 or 4 days after I held Felicity, so the beads are at much different points for some of those markers, so they'll be able to see that, yeah, even though you are identical twins, there were differences in the way that you behaved in the NICU, at least.
And the way you were cared for, and your own individual experience in the NICU.
It's so rewarding, and I think that's the thing about neonatal care. There can be very difficult times, but there's always times of celebration, and they don't have to be big celebrations. We can celebrate the small things and the large things because they're all progress for that baby toward a successful discharge.
I've looked at a couple different ways already to see how I'm going to display them.
They'll be hanging in their room.
Yeah, they'll be hanging up in their rooms.
These are their beads of courage. This has been their journey, what they've been through.